Good morning, Mr. Gale.
Good morning, my lord. This morning, my lord, we're beginning with a number of witnesses from the STUC and various affiliate unions of the STUC. And our first witness this morning is Rozanne Foyer, who is the General Secretary of the STUC.
Morning, Ms. Foyer.
Good morning.
And her statement is SCIWT 0817 and then 5 zeros 1. And therefore, with leave, my lord, I'll begin her evidence. Ms. Foyer, good morning.
Good morning.
You're Rozanne Foyer, I think, is that right?
I am, yes.
And I think you're known as Roz.
That's right.
More commonly. And you are the General Secretary of the STUC.
I am, yes.
And I think you took up that position almost contemporaneously with the first lockdown.
Indeed, yes, 16th of March.
16th of March of 2020. Yeah. Now, also in relation to your position as General Secretary, you have already given evidence to the United Kingdom inquiry when it sat in Edinburgh on Wednesday, the 17th of January of this year.
That's correct.
And your evidence, for the record, is recorded in the transcript of that day at pages 29 to 52. And you also provided a statement to the UKI, and we have available that statement to us. As I say, you gave evidence to the UKI in the context of Module 2A, as they are calling it, which was examining the Scottish Government's core decision-making between January 2020 and May 2022. And your statement to the UKI was divided into 5 parts. And for present purposes, we note that Part E of that statement is in respect of the impact on STUC members. But it was a relatively short part of that statement, as I've noted it. Again, just for the record, Ms. Foyer, you're agreeable that your statement be published and that the evidence that you give today in amplification of that statement is recorded and for our purposes
Yes,
as we progress. Thank you. You've provided us with a detailed statement, and we're very grateful to you for that. And as you say at paragraph 4 of that statement, the statement relates to the impact of those working within the health and social care sectors.
Yes, it does.
Yes. Your own personal background excuse me, is set out at paragraph 5. But can you just tell us a little bit about your role as General Secretary, what it involves, and in particular what it involved during the pandemic, because you were there from the outset?
Yes, I'm the Principal Officer of the Scottish TUC, and the Scottish TUC, as you will know, is the umbrella body for trade unions in Scotland. We represent over 500,000 trade union members, and our purpose is to coordinate and articulate and campaign around their views and aspirations as workers and citizens. In the context of the pandemic, we were obviously dealing with a very, very critical situation that affected many of our members, particularly those working on the front line delivering essential services. And the predominant role that we had was to liaise with and lobby government to try to get measures put in place to increase the protections available to our members and to campaign around the issues that affected them throughout the pandemic at their place of work.
Thank you. I'm going to take, for present purposes, given time constraints, as Foyer, the section of your statement in which you give an overview of the STUC as read. Safe to say that I think at paragraph 11 of your statement is you tell us about affiliates and works councils, and you helpfully set out at Appendix A to the statement a list of those affiliated unions which have an interest in health and social care. And during your, in the course of your statement, you, on several occasions, you quote from representations that have been made by various of the affiliates to illustrate various of the points that you're wanting to make. Is that right?
Yes, that's correct.
And can you just indicate how you went about choosing the various quotations that you've given, and just at this stage in general terms indicate what purpose you seek to make when you make these statements?
I think our purpose is in ensuring that, as far as possible, workers' voices are heard, and at the highest levels. By its very nature, the STUC's role is to take an overview. We had many affiliates contacting us around many different issues, and the statements I've picked would be the ones that show the most commonly experienced situations or challenges that workers were facing at that time. So it's to give some example and some voice to our members who actually were on the front line. We are simply the umbrella body that represents those views.
And I think we will be hearing from representatives of various of the affiliates, and we will get perhaps more of the context that those quotations are given in as we go through their evidence. One point I would like to ask you about at the outset is you have provided us with a brief overview of the STUC's engagement with the Scottish Government during the pandemic, pre-pandemic as well, but during the pandemic in particular. And I think, as you will appreciate, this is something that the inquiry will return to.
Indeed. When
we're going to be dealing with both implementation, but more particularly with decision-making as we progress through our investigations. But what I'd like to ask you about is to get some context for your evidence. I'd like to ask you about the COVID group that you mention at paragraphs 22 and following of your statement. Can you just tell us how the COVID group came about and what its purpose was?
Yes, we obviously very rapidly, like many organisations, went into a home working model, and a model where there were no physical meetings. We were dealing with a very critical and rapidly changing situation, and we needed a forum whereby our trade unions on the ground and our reps could get through problems, issues very quickly to us that could be escalated to the Scottish Government. We made an agreement with the Cabinet Secretary, Fiona Hislop, at the time that we would meet, and at the beginning it was very intensive engagement. It was twice weekly meetings, and the unions represented on the COVID group were those unions whose members were most engaged in the delivery of essential frontline services. We did bring in others from time to time, and that group was meeting, several times a week to escalate issues and to highlight problems to Scottish Government, areas where we saw gaps or action that needed to be taken.
And I think you indicate at paragraph 30 of your statement that the STUC was given good access to Scottish Government, and efforts were made by the Scottish Government to build effective communication channels so that workers' concerns could be raised and to discuss any issues or problems on the ground at the different stages of the government's COVID response as they emerged. So
Yes.
it seems a relatively, according to what you're saying there, a relatively positive engagement with the Scottish Government.
It was a welcome engagement, and it was very important that Scottish Government were talking to trade unions, because our members were in a position to highlight issues to them that they wouldn't have otherwise been able to address. So it was something that we saw as a very positive engagement. We didn't always get everything we asked for, but that access alone was a positive development for us.
And I think one of the things that we will hear about, both from yourself and from representatives of your affiliates, is that throughout the pandemic, your affiliates and indeed the STUC carried out surveys of members so that there was always an input into either the affiliate or to the STUC more generally of information which could then be translated onto the government as and when necessary.
Yes.
Now, you've listed in paragraph 30 various areas where this arrangement and engagement with the government had benefits, so I can put it that way. And you conclude at paragraph 31 that the engagement between the STUC and the government was such that insofar as the response to the pandemic was concerned, it did make a positive difference.
Yes, there were a number of areas where we were able to make progress on key issues on behalf of our members that had been very much lacking in the opening stages of the pandemic. We think that our discussions were able to make a positive difference around issues like PPE, around the introduction of a sick pay scheme for social care staff, around the Fair Work coronavirus statement, which many reps used actively in the workplace to secure terms and conditions that stopped any detriment to workers who were taking time off sick across the public sector, and a range of other areas where we felt that there was, some progress made.
Now, some of these issues are matters that other colleagues within the inquiry team will take up with the STUC, and in particular issues, for example, about sick pay, and because those fall within matters relating to welfare.
Yep.
So we in this at the moment we're conscious of what you're saying, but there will be further details in relation to those matters that will be taken up. Could I just ask you a little bit about what you say in the final part of paragraph 31 of your statement, where you say, as a result of the engagement that you had with the Scottish Government, the response of the government in Scotland was more agile and placed more emphasis on public safety before profits than the UK government did. And you go on to say, and lives were undoubtedly saved as a result. Yep. Can you expand on that a little, please?
I think there were a number of interventions where we were able to highlight concerns of our members. So, for example, areas like social distancing around the commute and transport for emergency workers, discussions around school closures and the timing of those and frequency of those, and a range of issues around public safety guidance that applied to specific workplaces that we worked on with Scottish Government, that introduced measures that were arguably more stringent measures than happened south of the border at a UK level, and we believe that that would save lives.
Yes. You do, however, qualify that in paragraph 32, and you say that there were examples where you did not feel adequately resourced to keep up with the speed of the engagement. Again, can you perhaps give us some examples
Yes.
of that and why there was perhaps a difficulty?
Well, I think it has to be remembered that the trade union movement is very much a voluntary movement. Many of our reps are workers who were working full-time in essential services and doing their best to represent their members. And the very best experience that we can deliver to government is the lived experience of workers who are reps in the workplace. So it was often very difficult when people were under real pressure to get a quick review of guidance or to consult effectively with the people who had the right expertise. An example of that perhaps would be, we lobbied very hard about a range of really serious issues around PPE, its availability, its suitability, its fit for purposeness in various situations. And when Scottish Government finally got round to producing its plan, it was in September 2020, and we were given only 24 hours to respond to the proposals in the plan, which we felt was completely inadequate, given that for months we'd been raising issues with Scottish Government around these very important areas of safety.
On that particular point, did you feel that there had been a delay in producing that plan, or was it that having produced the plan, there was inadequate time for you to make your representations in relation to it?
I think more than a delay, we felt actually on the issue of PPE that there was a huge failure by the Scottish Government to actually have a plan already in place, training already in place, PPE stockpiles already in place. There'd been enough reviews in previous years that we felt this guidance should have already existed and been available. And, that's one of the biggest failures for us in terms of frontline workers who were exposed unnecessarily to this virus, particularly in the early stages when the appropriate PPE just wasn't available, and it absolutely should have been.
I think, perhaps skipping ahead slightly, one of the points you make subsequently in your statement is the issue that the inquiry has heard a little bit about already, and that is the concentration in government guidance, or the basis for government guidance, on the mode of transmission of the virus being droplet transmission rather than aerosol and airborne transmission. And was that a problem that you experienced in relation to the availability and type of PPE that was made available?
Yes, that was an issue that was raised by a number of our affiliates, trade unions across the health and social care sector. I think the feeling was that the initial response of government failed to recognise the potential for aerosol transmission, and that the preparation just hadn't been done on the sort of masks and PPE that actually were required, and there should have been these measures already in place for the use of staff. So, for example, the FFP3 mask was severely limited, and it felt as though it was being rationed to a very small number of uses, and many of our members across health and social care felt that the procedures they were carrying out merited use of that level of PPE, and it just wasn't available for them.
Thank you. Taking the matter on a little bit and perhaps broadening the issue, paragraphs 37 to 39 of your statement, you raise the issue of austerity and indicate, if I can put it shortly, that was an issue impacting on the social care sector as a public service, which was already in crisis pre-pandemic. Am I right in understanding your position on that?
Yes, absolutely. The STUC had already, over several years, been involved in lobbying and campaigning around the issue of the underfunding of social care, and particularly the local government aspects of social care that's delivered in the community. However, the whole model is something that we had real concerns around, and I think that, it was of no surprise to us that much of the preparation wasn't there, given the overstretched nature already of staffing levels right across various parts of health and social care, and the cuts that had been made. There was already a recruitment crisis in social care, for example, before we entered the pandemic, and it's just been the perfect storm, really, in terms of where we've ended up now.
Was Brexit an issue for that?
I think in terms of the availability of workers, it has contributed, but I would say that the main contributory factors are the way that the funding model is constructed and the pay and conditions of workers in social care. It's an area where over 80% of the workforce are female. The work is undervalued, and the skill set required to undertake that work is not being properly remunerated. You can go and get a job in a supermarket and earn more money than you can doing the highly skilled work involved in being a social care worker.
Right. Thank you. Now, paragraph 45 and following of your statement, you've set out a number of recorded observations by several of your affiliates telling you and now us about the impact of the pandemic had on the levels of stress and anxiety experienced by, in particular, key workers. Now, obviously, this is a particular area that the inquiry is particularly interested in, because it's the stress, anxiety leading to mental health issues. Was that something that you and your affiliates were constantly aware of during the pandemic?
That we were acutely aware of that issue. Survey after survey, report back after report back showed us that we had a group of workers who were being seriously impacted by the work they were carrying out. And that's really wide-ranging, the mental health impacts, and really long-term consequences of those impacts. I mean, we're talking about workers many of whom were on pretty low levels of pay and conditions, but were being exposed to unprecedented levels of human suffering and death around them. And the staffing levels, because of the high sick leave levels, there was a really vicious circle of people going off with stress, but also with COVID and long COVID, and then staffing levels being completely unsustainable for those left in the workplace who were doing their best to cope in a crisis situation. There were people moved into areas they didn't have experience of and hadn't worked in before. There was very little mental health support on an ongoing basis for that workforce. But, you know, we're talking about workers in extreme distress and who were burnt out, who were mentally and physically exhausted, who have suffered post-traumatic stress disorder as a result of their experiences. And now what we're seeing and have seen, you know, during and immediately after the pandemic, where our unions reporting back to us about unprecedented levels of workers taking early retirement and leaving their roles because they just, you know, it wasn't an experience they could go on with. So it's something that I think really needs to be understood, that these are a group of workers who were putting themselves and their families at risk on a daily basis, and the fear factor for those workers took its toll massively.
Were those effects long-term?
Yes, I would say so. I think we are still seeing, you know, when we look at staffing levels across social care and in the health service in Scotland, we are still seeing the aftershocks of the crisis, and many of our members, you know, long COVID and the physical effects of COVID are one thing that's still long-term, but the mental effects of COVID are perhaps a hidden aspect of this, but had a very high impact on our workforce.
One of the points you made in one of the longer answers you gave, sorry, that's not a criticism of the answer, but one of the points you made was about, if I can put it this way, redeployment of workers to areas perhaps that were not their normal area of specialty. Is that something that, again, the STUC was aware of during the pandemic?
Yes, we had. I think GMB actually gave us an example of, you know, workers who, you know, wards were being closed down due to lack of services. Non-essential work was not getting carried out by the NHS, and workers were being redeployed sometimes into intensive care units, which were probably the most difficult places to work at that time when the pandemic was at its height. And, you know, the after effects for staff who perhaps hadn't been fully trained for some of those roles were quite severe.
The point you make at paragraph 51 of your statement is the ever-changing guidance.
Yep.
Again, this is something in a variety of contexts that the inquiry has heard about and is conscious of. Obviously, with rapidly changing and substantially changing of guidance, the need to understand that and to communicate that to workers and those who required to observe it was an important consideration. What was the TUC's position on the way in which guidance was changing very rapidly? I
think that there was an understanding that by its very nature, given where we might not have started out in the ideal place, but given where we had started out from, there would be a need for guidance to be updated and to change. And that did put pressure on, you know, additional pressure on staff's mental health, but at least in areas where, you know, there were recognised trade unions, there were health and safety reps. What our reps reported was they spent a lot of time on rollout of new guidance and on making sure that their members were aware of that guidance. I think in our experience, where that system of new guidance being introduced very quickly started to fall down even more was across areas of social care, where perhaps a lot of the guidance wasn't getting through, wasn't being disseminated and wasn't being, you know, fully understood or being misinterpreted by some smaller employers. And that was a real concern to us. Just can I move on to the question of recruitment and retention of staff? This is something you deal with at paragraph 58 of your
statement, and you refer to, I think, the fact that the negative impact on recruitment and retention of staff is something that is evidenced by the Scottish Government's announcement to invest an additional £15 million to address staffing shortages in the NHS. Obviously, that's part of the social care and health workforce. What's the position as far as your members are aware of the impact on recruitment and retention in the social care sector, which is not part of the NHS?
The feedback we've had from member unions on social care in particular is that it is in a very, very unsustainable shape at the moment. I think you referred to some of the migration policy of the government, and I think that, you know, another blow has very recently been dealt to the sector through some of the UK's migration policy, stopping migrants from bringing family members to settle with them. But we have a situation where the use of agency labour is through the roof. That in itself is not a good use of public funding in terms of it's much more effective to have a stable workforce. But given the rates of pay that are offered in social care, it is very difficult to recruit workers into that sector at this point in time. And I think many of the experienced workers who worked through the pandemic had such a traumatic experience that many of them have left the sector. So we have a really difficult situation in social care at the moment, and it would be the STUC's contention that actually social care is one of the areas that we really need to look at and learn lessons from. We are extremely concerned that some of the lessons that had been learned about protecting workers and making sure they didn't suffer detriment from long COVID, or around making sure social care workers do receive full sick pay to take time off when they're unwell. These things have already been rolled back on, and you know, it just shows that we're not learning some of the key lessons that came out of the pandemic, hence why we're still in a state of deep crisis in social care.
Okay. Can I refer you to paragraph 66 of your statement, please? And this is, we will hear from the Unison affiliate representative in due course, but I think it's useful to get this piece of evidence out at this stage. There was a Unison survey of social care workers in 2021. It's reported in a document called the Burnout Pandemic, dated February 2022. And that's something you provided to the inquiry, and for which we're grateful. Can you just explain what was being shown in that, and the point that you're highlighting, what was being shown in that report?
I think what has been demonstrated is a really vicious circle in social care, because you have a situation where the staff are burnt out, they're stressed, they are experiencing or have experienced over the period leading up to that survey real trauma in their workplace with unprecedented situations that they'd never had to deal with before. That in itself caused many social care staff to have to take time off because they either had COVID or they had long COVID, but there were also the added addition of workers who were stressed and burnt out having to take time off. That then created a situation where staffing levels were very acute and people were really short-staffed, which put more stress and pressure on the workers who were left. And I think you have to add into that really toxic mix some real issues in certain parts of social care around a lack of interpretation and understanding of guidance. So we've got evidence where some employers were not applying the sick pay scheme even though it was available to them. We have evidence of PPE being rationed or unavailable to workers in those areas, and you know, a really, really difficult sector to work in, and a lot of those workers felt abandoned, really, and very, very low. Also, just their experience of watching their residents, who they care deeply about, and the situations the residents were going through, was really upsetting and distressing.
The one thing that you do highlight at paragraph 66 was what you term a staggering 96% of staff who took part in the survey reported staffing shortages. Now, I suppose one could always expect staff to say, there's not enough of us, we're experiencing shortages. We would want ideally more staff. But was that level of response, in your view, indicative of a more serious problem?
Yes, we're talking about extremely serious levels of staffing shortages that necessitated, you know, very difficult action to be taken. So, for example, in home care in Glasgow, at one point they had to reduce their service to life and limb cover only, and thousands of clients and users of that service no longer had care packages for a period of time, and you know, that was just one example of some of the quite large measures that had to be taken. And you're talking about home care workers who then are really worried about some of the clients and users of their services. By its very nature, care involves emotional investment by the worker, and you don't just stop looking after someone and not worry about them. So, you know, when you've got those kind of difficult decisions having to be made on a daily basis, and where you're having to actually compromise the level of care and the services that you're delivering, that is soul destroying for care workers.
I suppose one of the points that perhaps is not always appreciated is that carers can develop a bond of affection and with those they are caring for, and either the deaths or the illness of those people that they're caring for is something that they can feel very deeply.
Absolutely, and I think that, you know, I would change that word from can to do. You know, they do habitually develop that bond. I would say that's part of good care, is that emotional aspect, and you know, that requires real skill, but a lot of genuine emotional investment by the employee involved in delivering the care.
Excuse me. One of the tragic aspects of the pandemic, amongst many, I suppose, is the level of deaths within those providing social care. And you deal with this at paragraph 67 and following of your statement, and thank you for the reference to the paper by Professor Taylor. That's something we will be looking at. You do make reference at paragraph 69 that there is insufficient data on worker deaths during the pandemic, and the available data can be difficult to reconcile. Can you explain that, please?
Yes, we became increasingly concerned that due to the very emergency crisis nature of the pandemic across our health and social care services, that normal reporting procedures weren't being followed in a great many cases. And for us, this was a concern because, you know, we believe that there is very strong evidence that shows that certain occupations were directly affected, and that their exposure would have been through their occupation and their workplace duties. But in many cases, exposure to COVID wasn't being recorded under RIDDOR and other health and safety processes in the way that it normally would have at a non-crisis, non-emergency time. This was predominantly down to the staffing shortages and the resource issues that we've talked about. So, for example, in the NHS, our understanding is that this only was carried out in its fullest form when there was a fatality. But we believe that across wider health and social care, there were reports being missed or not attributed to workplace exposure that should have been attributed to workplace exposure at the time.
Just an expression that you use, and you use it again later in your statement, which you use in paragraph 71. And you say, other research suggests that differences in mortality rates across occupations reflect both occupational risks and the social class gradient in underlying health. And it's that expression, social class gradient in underlying health, that I particularly want to ask you about, because as I say, you use it again later on. What are you conveying with that?
I think what we are conveying with that is that there is evidence to show that COVID was a class killer in terms of, you know, your social class matters in whether you contracted COVID and also as a determinant in how serious your virus may be. We found that, you know, you can look at occupations, but when you start to break down those occupations, those, you know, who worked in clinical health in higher grades, for example, were less likely to be exposed to COVID or to have a fatality from COVID, whereas those on lower grades and in lower socio-economic groups would be more likely to succumb to it, but also succumb more seriously to the effects of the virus. So I think, you know, it disproportionately affected people. Now, some of that might be due to underlying health issues to begin with. Some of it, though, we feel was around the sort of work that was being carried out. So people like the people who were cleaning out the ambulances, the porters, the cleaners in hospitals, you know, might not have been getting the best kit and the best PPE, but they were undoubtedly being exposed to the virus, which we now know was airborne on a daily basis. And, you know, we think there are key lessons to be learned there in terms of, you know, which roles were exposed and also the impact on those people.
Thank you. Long COVID is something you deal with in your statement. And again, this is something the inquiry has had a considerable amount of evidence about so far, and will continue to hear more specific evidence about it. One of the issues that we've heard evidence about is the skepticism really across various sectors, including among health professionals as to the veracity, if I can put it that way, of long COVID. Paragraph 77, you refer to the steps that the TUC, excuse me, the STUC has taken to highlight the complexities in diagnosis, etc., and the support of members suffering long COVID. Can you tell us what steps the TUC has taken in that regard?
Yes, we've worked with Long COVID Scotland to highlight awareness of long COVID as an issue. We've held events and briefing sessions for trade union representatives so that they can support members who are reporting long COVID, and we have promoted reports and research around long COVID and who it is affecting. For us, long COVID is a serious issue that needs to be recognised. We believe that you know, over 175,000 people in Scotland have reported symptoms of long COVID, and we have workers across health and social care who are still suffering the long-term after effects of having been exposed to COVID, and in some cases that is life-changing for them and is having an ongoing impact on themselves and their families. So we would like to see long COVID being recognised as an industrial occupational illness, and appropriate industrial injury benefit being applied to sufferers of long COVID, as well as compensation for those that paid the ultimate price and had fatality as a result of exposure.
Is it your experience that long COVID presents an obstacle, or is continuing to present an obstacle to staffing, particularly in the care sector?
It's our experience that there are enough people who, it's certainly an obstacle to staffing levels in terms of the numbers who have it. There's only a small number of people who have it on a very, very long-term basis. But for those workers, it certainly is an obstacle to them re-entering their roles in the workforce. And at the beginning, we had a statement, a Fair Work COVID statement that we'd agreed with the Scottish Government that covered most of the public sector and a range of publicly funded areas, that said that workers shouldn't suffer any detriment should they be off with long COVID. That statement was changed and withdrawn so that protection no longer exists. So many of the workers who have serious cases of long COVID actually are no longer able to be part of the social care workforce. They've been removed from the workforce.
Can I move on to the, perhaps, excuse me, one of the more controversial subjects, and that is the availability and sufficiency of PPE.
Yep.
You've provided us with a section of your statement headed Infection Prevention and Control at paragraphs 82 to 101. And again, you provided the inquiry throughout that with various references to observations from a number of your affiliates, and obviously we can read these. There's a couple of points I'd like to take up with you. First of all, at paragraph 88, you observe that unions would advise their members in certain circumstances to utilise the protection afforded by Section 44 of the Employment Rights Act. Can you explain why, in the context of the availability or non-availability of PPE, that right or those rights might be invoked?
Yes, Section 4 of the Health and Safety at Work Act allows an employee to take appropriate steps to protect themselves from serious or imminent danger to their health and safety. And there were occasions, particularly in the early stages of the virus, and I remember the Scottish Ambulance Service being a really difficult area at that time, where appropriate PPE was not available in a whole range of areas, and trade unions and their members were growing increasingly concerned, and Unite, the trade union, did advise its members to invoke Section 44 of the Act if they were not issued with suitable PPE and were being sent out to deal with situations and carry out their duties. And if they were feeling unsafe and they felt they hadn't been given appropriate PPE, it was advice they were given that they could invoke Section 44. This was at a point where, other unions who operated in that sector, GMB, I believe, sent an open letter to government to highlight the extreme concerns that workers had. We almost had a mass walkout at that stage. The situation was resolved, but it was really, really telling of some of the massive failures of government to protect their frontline staff, that the PPE just wasn't there. The stockpiles that should have been there, the equipment that should have been available to staff for just such a situation wasn't available to them when they needed it most, and that was a real failing.
Second point I'd like to ask you about is what you say at paragraph 89 of your statement. You say that in the early stages of the pandemic, that staff in a variety of healthcare settings were not receiving PPE, and you tell us that this was raised frequently, initially with Fiona Hislop, who I think was the Cabinet Secretary for the Economy at that time. Explain what was done at that stage. What representations were you making?
So at that stage, we were in touch with the Cabinet Secretary. That would have been one of the very earliest meetings. I actually think that was a specific meeting around that issue, if I can remember correctly. We were raising it not only with the Cabinet Secretary for Economy, who was our key contact in the COVID group, but it was also being raised, obviously, with the Cabinet Secretary for Health, Jean Freeman, and across, you know, we were also highlighting it to the media as well, because this was something that was going to lead to a crisis situation if our members didn't feel safe at the very basic level to carry out their duties in the context of the pandemic.
Interestingly, at paragraph 90, you tell us about an online survey which was carried out in the last week of March 2020, so very early in the pandemic, and reported that over half of respondents required to work didn't feel safe, with 42% saying they did not have access to adequate PPE.
Yeah, and at that early stage, we're not just talking about, you know, that this is right across health and social care. We had areas that you would expect, you know, our emergency services that didn't have access to adequate and appropriate PPE at that stage. But, you know, we had areas, you know, local governments, social care workers that were supporting people in their homes. I'm aware of reps who were going out and buying hand sanitizer and masks for their members out of their own money to try and give them some protection. There was a massive shortage of PPE right across the public sector, and the private sector was in an even worse state, to be honest.
Now, you provided us with a useful a summary of the issues that were caused by the limited supply of PPE. You do this in paragraph 95 of your statement. And obviously we can read all of those. There is one that I'd like to take up with you, and that's one that you actually go on to talk about a little bit more in paragraph 96, and that's the use of out-of-date PPE. And you make reference to GMB, and your colleague from the GMB will be telling us about that in some more detail. So far as you are aware, is there and was there a problem with remarking PPE with and covering up dates, essentially expiry dates of PPE? Is that a problem?
This is our understanding of the situation. It was reported to us by GMB at the time that this issue had arisen, alongside all of the myriad of other issues around PPE that were reported back to us by our various different affiliates. But yes, that is correct. This was highlighted as an issue, and obviously an issue of extreme concern to the members in that particular service.
Okay. Mindful of the time, Ms. Foyer, can I move on to your section on risk assessments? And just very briefly on that, You say at paragraph 109 that union workplace representatives were reporting that they were often left to police workplaces. Again, could you give some context to that, please?
Yes, I think that although lots of work had been done to produce guidance for a range of workplace contexts under public health regulations at a Scottish level, in many cases there just wasn't the resource within the Health and Safety Executive or environmental health officers due to cutbacks for them to go in and police the implementation of this, and in many areas it was being left to union reps themselves to make sure that guidance was being followed, being disseminated to workers, and this was a real issue for us. I also think that the validity of the guidance was diluted somewhat. There was a weakness in the enforceability of a lot of the workplace guidance, with many UK companies simply choosing to ignore the Scottish guidance and go with UK guidance instead. And that's something that we've got some concerns about, and actually think there's a case there for health and safety and employment law to come under the powers of the Scottish Government.
Yes. I'm sorry, I wasn't cutting you off.
No, that's okay.
Yes,
so, you know, these were real areas of concern for us at the time.
Can I just move on finally to protected characteristics and disproportionate impact?
Yes.
You'll be aware that the inquiry has a remit to consider some of the inequalities of the impacts of the pandemic and the strategic decisions taken, and I think you very helpfully set out in paragraph 139 certain of the groups who were in receipt of disproportionate impacts. Obviously, the large cohort of the social care sector is female.
Absolutely.
So, we can read all that information, Ms. Foyer. One point I would like to ask you a little more about, and that is the impact on black and ethnic minority workers. You talk about this in particular at, I think it's page one, paragraph 141 of your statement. Can you just perhaps indicate what point you're trying to get across in relation to the impact on black and minority ethnic workers?
Yes, I think the context of this paragraph has to be, you know, heard in the fact that we have concerns about the breakdown and there being enough data at Scottish level around BAME communities and the impacts they were facing, and this is something we called for at the time because we were receiving reports and it was feeling to us anecdotally like, you know, deaths were higher among certain parts of the BAME population, and the impact was higher. And we're noting in that paragraph that this was confirmed by the national statistics that were being produced that did show that more BAME workers were contracting COVID.
Yes. Thank you. Now, you've set out, finally, Ms. Foyer, the lessons to be learned at 149 and following of your statement, and your hopes for the inquiry at 161 and 162. Again, these are matters that we can read, and we are very grateful to you. I think in our own discussions, I think I've made the point that there are certain things that we cannot make recommendations in relation to, and I think you appreciate that.
Indeed.
But from your perspective, having had the discussion we've had today and provided the evidence that you have to this inquiry, is there anything else that you would like at this stage to add and you feel that we may not have covered properly so far?
Yes, thank you. I think that too many workers across our health and social care sectors were placed at really high levels of risk, and it needs to be understood and investigated by this inquiry that a lot of those risks could have been avoided if proper planning, PPE and guidance had been in place. And, you know, as far as we're concerned, our governments, both at UK and Scottish level, really failed on that particular point, and that had a devastating impact on the outcome. You've referred to the data from Professor Phil Taylor, and I think it is important to highlight that, you know, workers across health and social care were 4 times more likely to contract the virus than the average worker, and Equality and Human Rights Commission figures point to a disproportionately high level of deaths amongst social care workers. So, you know, these workers placed themselves in some cases in lethal danger in service to their communities, and we feel that action needs to be taken now to make sure that those that are facing long COVID and those that have passed away as a result of their exposure to COVID are receiving meaningful state support. There should be compensation due as a result of death or long COVID, and it should be classed as an industrial disease. And I think social care in particular is an area that is crying out to be looked further into. It needs to be valued and funded sustainably, and all social care workers need to have access to full contractual sick pay. And instead what's happened is they've been largely left to rot. Nothing is changing in social care. In fact, some of the things that were put in that improved things for a while have been rolled back on, and that is not good enough for our social care workers in Scotland.
I think the call for social care to be valued more highly is something we've heard from a number of people across the board, so we are very conscious of that. But Ms. Foyer, apart from that, thank you very much indeed for your evidence.
Thank you.
Thank you, my lord.
Yes, thank you, Ms. Foyer. Very good. Shall we say 10:50 to resume?
Thank you, my lord, yes.
Now, good morning, Miss Bramley.
Good morning, my lord. The next witness is Dave Moxham, who's the Deputy General Secretary of the STUC. And for the record, his statement reference number is SCI WT 0439-501.
Very good. Good morning, Miss Moxham.
Good morning.
When you're ready, Miss Bramley.
Thank you, my lord. Mr. Moxham, please could you tell us how long you've worked at the STUC?
I've worked for the STUC for just about exactly 20 years.
Thank you. And how long have you been in your current role?
In my current post for 16 of those years.
16. Thank you. As you know, we've just heard from your colleague, who's the General Secretary of the STUC. Please would you tell us about the role of the Deputy General Secretary and how that differs from the role of the General Secretary?
Yeah, so as the title suggests, there is a deputising role, so that in the case that the General Secretary is otherwise occupied, I would be expected to be able to undertake the majority of her roles. However, I had defined policy roles within the STUC, including campaigns and communications, where I was responsible for our media output and our general communications with the outside world. But over those 16 years, I've obviously held a wide range of different policy responsibilities, including the public sector, working with the voluntary and care sector in a policy capacity, and really any other policy area that the General Secretary would ask me to cover.
Thank you. Given that you were at the STUC for such a long time, can you tell us a bit about the relationship of the STUC with the Scottish Government prior to the pandemic?
Yes, I mean, over a long period of years, I'd say that we enjoyed a positive, if critical at times, relationship with respective Scottish governments. We had engagement across a wide range of policy sectors. That would be dependent somewhat on the engagement that our affiliated unions had. So, for instance, in the NHS, where there's well-developed partnership relationships between the unions and the health authorities, maybe less so. In other areas, such as hospitality, where there's very little trade union presence, we would take a greater role. We would tend to coordinate meetings and engagement between unions and the government where multiple unions were present in order to get the most streamlined and effective way of engaging between the trade union movement and government.
Thank you. Would you have regular standing meetings with the government, or were the meetings just ad hoc as the need arose?
A range of standing meetings. We would meet twice a year as a set piece with the First Minister and members of his cabinet, depending on subjects to be discussed. There would be an expectation of regular meetings with other cabinet secretaries and policy leads, although they wouldn't be diarised in the same way as the meetings with the First Minister, but across any given year I would expect and still expect to have upwards of 20 meetings with one Cabinet Secretary or another, which I would characterise as a fairly consistent and deep engagement.
Thank you. And prior to the pandemic, where did the meetings take place?
There were a range of venues, most normally in Edinburgh, quite often in the Scottish Parliament, but quite regularly as well in Scottish Government buildings such as St Andrew's House or Atlantic Quay.
Thank you. Now, when it became clear that the pandemic was going to affect society before restrictions were in place, what action did the STUC take to ensure it was best placed to utilise the relationship it had built up with the government?
Somewhat fortuitously, we had a pre-arranged meeting, which I think from memory was March the 5th, with the Economy Cabinet Secretary Fiona Hislop, which hadn't been set with the view to beginning discussions on COVID, but by the time the meeting came around, it was a clear issue. So we were able quite early in that meeting to raise the issue, which obviously the Cabinet Secretary was happy to agree to. Thereafter, we had reached a very quick understanding that government and trade union engagement at accelerated rate would be required. So we were reasonably well placed in terms of contacts and early dialogue to begin the process of agreeing a more formal engagement. We then, as you've heard, contacted what I will use as our key affiliates, representing a range of those most affected and those largest, and began the process of bringing them together in order that we could directly agree initial plans for engagement with the Scottish Government.
Thank you. And was that as part of the COVID-19 group?
That was part of the COVID-19 group, yes.
Thank you. And I believe initially you also became involved in COSLA, the Convention of Scottish Local Authorities.
Yes, so COSLA created quite quickly a workforce issues group which brought together not just its own officers from Solace, and a range of unions, again, either what we describe as our local government unions, the GMB, Unison and Unite, but also our teaching unions in order to deal directly, I guess, with local government, and obviously that covered care and education issues too.
Your involvement in COSLA was limited in duration. Did you feel that, was that a decision based on resources, that you thought resources would be better used elsewhere, or did something else affect that?
Partly. I mean, I think it was important for us to be engaged in the first instance because obviously we have particular experience as the STUC in convening, if not in the context of COVID, in other contexts, the coming together of employer organisations and trade union organisations, and also simply because it was our business to ensure that that group was operating as effectively as it could be from our perspective. Within a couple of weeks, I would say, my engagement, I was always party to the minutes and various correspondence that took place. It was clear to me that our three lead local government unions and the education unions were engaging fairly intensively on that. It didn't mean, because there were a variety of vehicles through which issues could be raised, that didn't mean that on occasions information wasn't given to me, which through the COVID-19 group then found its way to government. But on a day-to-day basis, the unions were very, in my view, well prepared and well informed and able to take that forward, allowing me, as you suggest, with very scarce STUC resources to concentrate the majority of my activity elsewhere.
Thank you. In your early meetings with the Scottish Government before restrictions were put in place, but when it was clear that they were coming, were you able to raise concerns that your members had about what was going to happen and perhaps how prepared organisations were?
I would hesitate to, I think we were able to. I would hesitate to say that we had sufficient information ourselves at that point to anticipate anything like the depth and longevity of the crisis. So I would characterise it as a mutual recognition that we would need to talk and talk again soon, rather than the raising of substantive issues. I do recall on the 4th of March us turning up with hand sanitizer because it began to be suggested that measures would need to be put in place, but we weren't at a position at that stage to define what actions there would be, rather the form of communication and engagement that we foresaw being required going forward. And
I presume the response was quite positive from the government's side?
Yeah, I would categorise it as extremely positive at that stage in terms of engagement.
Thank you. You mention at paragraph 30 that the fire service started advising members not to attend large-scale public events, and others started to ask about whether they should be issuing messages. How did you deal with that?
In a sense, this is an anecdotal example of how we as a movement were becoming aware. This pertains to a conference that we were holding in late February, and we were aware enough at that stage that things were on the move in terms of potential adaptations and workplace action without obviously having a clear picture of what that would look like. At that conference, we were sufficiently concerned to take a decision, which clearly we wouldn't have made now, that conference could go ahead, but we were already looking at the environment of the room and the distance that would be required between participants. We heard at that stage that members of the Fire Brigades Union, who had previously registered to attend the conference, had been instructed that they shouldn't be attending such gatherings. So in a sense, that was certainly my first inkling that there was going to be the requirement for a wider public sector health response.
Mm-hmm. Thank you. And once the lockdown and pandemic restrictions were put in place, what was the immediate impact on the STUC and your ability to carry out your functions?
You talking internal organisationally?
Both,
yeah.
Really.
I mean, organisationally, we wanted to respond quickly. We vacated our office very quickly. We put in place, I think, swiftly guidance for staff and support in terms of their own working environment or their new working environment. We had to move quite quickly, obviously, to adapt to the fact that we did need a lot of engagement, both with our affiliates and government, and obviously we're no longer going to be doing that in person. So we moved to investigate other forms of communication, the ones we now use, WebEx, Zoom, and others that we now use quite regularly. So we were affected, but I think we moved fairly efficiently, or as efficiently as I would have hoped, to finding other forms of communication and ways to engage with our members and government.
You mentioned in your statement that two main areas of focus for you were your role as government liaison and also the issue of outward communication with members. Can you firstly tell us about your role as government liaison and how that changed over the course of the pandemic?
Yes, so I wasn't initially, my job description wouldn't have included the being the first point of contact with government. That would have been one of my colleagues, a policy officer, that she subsequently left our employment and I moved into that primary role. Having said that, it was all hands on deck, and obviously with considerable years of government engagement and contacts with government, I guess I played a pretty intensive role even before the point when it became for a number of months, my primary role.
Mm-hmm. And was the main sort of change really just being online for these communications, or was there a difference in the quality, the frequency, the issues you were able to raise, access to individuals?
Yeah, I mean, there was an exponential growth in the number of issues that we had to raise, obviously, and therefore the frequency of that engagement. So you've heard about set-piece engagements that we undertook twice a week with the Cabinet Secretary, Fiona Hislop, but almost on a daily basis from the point that began. I would have been in contact with our Fair Work liaison officials who were our first point of contact, although even those points of contact grew over the months, but they were our first point of contact, and I would barely a day would go by in those first months where we weren't in daily contact with our liaison contacts.
Can you also please tell us about your role in communicating with members and how that changed with the onset of pandemic restrictions?
Yes, so I mean we have, as the STUC, we're not actually a trade union. We are, as you know, a representative of trade unions. Most of the direct contact with members would normally be channeled through our respective unions. So they obviously are the first point of contact with members. And again, as you've heard, we had a system for elevating those using standard trade union democracy of members talking to reps, reps talking to officers, officers talking to senior officers, and us convening those. But the STC also has a somewhat wider role that we adopt for ourselves, remembering that only 30% of people in Scotland are trade union members. That would probably extend to 50% who enjoy trade union coverage, which means to say they might not be members, but they are part of a collective bargaining arrangement and therefore are afforded, without paying their dues, the same sort of collective coverage and protections. But that leaves 50% of members who aren't in that situation. And therefore we've always had a role where, in general terms, using social media, using other media functions, we've attempted to communicate to workers and for workers some issues where trade unions, for obvious reasons of not representing them, can't. So at the same time as developing these more, I guess, formal, understandable systems for communicating the views of members, we also wanted to use social media, our website and other functions in order to assist the wider workforce who didn't enjoy trade union protections.
Can you give us some examples of the types of issues that you addressed through social media?
Yes, so the very first one which we elevated was in relation to, not directly relevant, I guess, to health and social care, the lockdown itself and the move away from work in all but essential workplaces. So we were made aware through social media, through phone calls and others, of some fairly significant employers in a range of sectors, but retail would be a good example, hospitality would be another, who simply hadn't listened to the guidance. So even over that first weekend and throughout the week, we were receiving multiple reports, and we were publicising where we were clear that breaches were taking place. We were publicising these in order, obviously, to protect the workers concerned, but also to raise consciousness and awareness of the fact that this was a serious situation and people better be listening to the guidance.
So did you hope that by sharing on social media information about organisations that were listening, that those organisations might take notice and maybe realising it's being highlighted to take different action?
And being frank, it's not an unusual tactic or strategy for us to do such things. As I say, where you don't have that direct role of a trade union within a workplace, then you have to find other ways to do your best to ensure compliance and what we describe as good employer behaviour. So we don't have any compunction if we think the case is justified in publicising the fact that one workplace or one particular sector are falling short of expectations, and in our view that was particularly important in the context of the pandemic when lives were at risk.
Thank you. Did you also raise that issue with the Scottish Government, that despite guidance there seem to be so many organisations that aren't following that? And if you did, what was the response?
So I think the initial response was positive from the government in the sense that they valued the fact that we were able to provide that intelligence, whether it had been gleaned from our unions directly or this kind of wider information role that we were playing. And I feel that in the forthcoming weeks and months, when we talked about the creation of particular government groups in areas like construction, manufacturing, retail, hospitality and others, that was partly a result of the fact that we were able to be a key source of information for the government that things weren't going right. There was also, at one point, I couldn't remember exactly when, but fairly soon into the pandemic, the creation of a Scottish Government helpline, which we were able to direct people towards. So I guess our strategy was to try to do the best we could to deal with individual, by which I mean single workplace issues, but also collectivise those and present them as strategic issues that the government needed to address through various mechanisms.
Now, in your statement, you state that you used meetings with the Scottish Government, at least in part, to have an influence on the First Minister's daily briefings. Can you please expand on that and tell us about the types of issues that you tried to raise and influence?
Yeah, so I mean, obviously it would be broad, and in particular, obviously on a fairly regular basis, the Scottish Government, the First Minister, was announcing particular restrictions on travel, on lockdown itself, and then obviously on a range of issues which were advice to the public, but also advice to workers and employers as well about what was considered acceptable and non-acceptable in terms of their behaviours. Now, you know, I can remember on a number of occasions having meetings even in the morning before the First Minister, not with the First Minister, but before the First Minister made her statement, pushing very clearly on issues such as, I guess, as things went on, how quickly we should move out of lockdown, the balance between commercial and safety interests, where we would then watch with a great deal of interest what the First Minister said, and were able, in some cases, to be very welcoming, feeling that we'd had some effect, and in others not so much.
Mm-hmm. On balance, do you think you were sufficiently listened to?
I feel that we were sufficiently listened to. My personal view is that as the pandemic progressed, as additional pressures were put on the Scottish Government with respect to the economic outcomes and the business outcomes and impacts of the pandemic, that government became less easy to convince of what I would broadly categorise as our safety-first approach. So I think as we were accelerating safety measures, we were being listened to fairly well, fairly reasonably. As they were being relaxed, there were times when we felt they were relaxing too fast and too soon. Mm-hmm. There were a couple of very specific examples, again, this more in the education sector, around schools and around the opening of universities, where we were particularly disappointed, and our education affiliates were particularly disappointed that we weren't listened to.
Thank you. You also say that you felt throughout that you could be critical of government as required without damaging that relationship. Could you expand on that, and are you referring to the situations you just mentioned, or did it go beyond those situations?
No, it would largely be around those situations. I mean, obviously, we were very, very stridently critical in a number of areas, which you've heard around readiness generally, PPE, and then, as I say, the speed of emergence from lockdown, where, you know, we would be very, very publicly critical, and that would get significant media attention. So in a sense, you're looking the next day to see whether the attitude of ministers or their availability has lessened. And I would say in general terms, they weren't. They were still open to meeting with us, still open to engaging with us. So, you know, we do feel, and this is something which goes beyond COVID, that we have a fairly respectful relationship with government, where they recognise that we have to be independent and critical, even though we will work with them when we can.
And do you think that the STUC was always sufficiently resourced to be able to engage with the government and members and carry out its activities?
No. I would say as a general as a general observation, that probably the general public think that the trade union movement has far more employees and far more resources than it really has. The STUC itself has around 30 employees, but only 15 of those would be allocated to what we call core activities. That's to say, activities which aren't externally funded and therefore vied to a particular activity. Now, I would guess that people think that we have more than 15 core employees, so it's always a struggle. But in this circumstance, when we were the point of contact for government for almost any workplace issue that they think that workers should be consulted on, and when our need to coordinate the activities of our affiliated unions was so enhanced because of the sheer number of issues they were having to deal with, we weren't adequately resourced. And possibly if I had my time again, I might have been clearer with government earlier that we needed assistance, because a lot of assistance was going out to business and other organisations. And we, largely speaking, with a couple of small exceptions of support, we, largely speaking, subsisted and worked on the basis of the resources that we'd had going into the pandemic.
We heard from the Secretary-General that the health and social care sector as a whole was struggling prior to COVID. In your statement, you talk about the social care sector being particularly in a difficult position. Could you expand a bit on a bit more about that, and how prepared it might have been, whether it was clear how prepared it would have been for a national emergency or pandemic, and whether those issues were raised with the government prior to COVID becoming even known about?
Yep. From the STUC perspective, I can talk with more authority about our work around the terms and conditions of voluntary sectors and social care and private social care workers, rather than the readiness of the service itself in kind of like medical or structural terms. I'm sure you'll hear from people much closer to that. My work, and this started, I guess, in the late 2000s, was in a specific forum that we created. It was called, I can't remember its name, but it was a coming together of CCPS, which is Community Care Providers Scotland, various other care providing and voluntary sector organisations and the unions who were involved in the voluntary sector and social care. And we jointly identified at that time not just pay, but other terms and conditions such as pensions, which were sadly poorer in the voluntary and private sectors than it was in the direct sector. And we identified from a very early stage, and this in a sense was the genesis of the Scottish Living Wage campaign, and then the Scottish Living Wage as announced by the Scottish Government and its application to social care. We identified that not just was this an issue of dignity for what was predominantly a women workforce, but it was also having impacts in terms of delivery. And we were able jointly with the umbrella body CCPS to raise this with government on frequent occasions, and to raise this with local authorities. So at that stage there was a reasonable coming together on pay and terms and conditions, and the genesis, I think, of an approach which strongly correlated the treatment and terms and conditions of care workers with the outcomes that were being provided and failing to be delivered sometimes in the care setting.
Yes, and was it recognised that this was having an effect on the sector's ability to recruit and retain staff? Absolutely, and
this was messaging clearly that we were getting from our own affiliated unions, but there was very, very little difference in between us and the social care employers at that stage. There was a difference perhaps in terms of where we might have seen the ultimate resting place of all social care, which, as you know, we believe in direct public provision allied to some not-for-profit care. But in terms of the funding of the sector and the guarantee by government of minimum wages and terms and conditions within the sector, at that stage there wasn't much difference between us and and the umbrella bodies for the care providers.
How did the government respond to those issues being highlighted?
Well, you could argue that certainly in terms of pay, ultimately we got somewhere, because they did introduce, after more years than I would have liked them to, and after more years about the interpretation of European law, that they would implement the living wage for social care, which obviously we saw as a victory. We think it took too long, and we think it took, and it is still the case, that they do not necessarily align their public statements on what they believe social care workers deserve and the funding that they provide for the sector in order to deliver it.
And beyond pay, do you think there's anything the government could have, the Scottish Government could have done to try to increase the number of workers in the sector? I
mean, pay is obviously the main thing, and the General Secretary previously talked about some UK decisions which have affected the supply of carers, such as migration policy. And to be fair to the Scottish Government, they would love to have that devolved and therefore to meet some of our labour market needs. But you know, successive governments have overseen a splintering of the care sector between direct, voluntary and private. And you know, despite us arguing consistently and for many, many years that had to change, it didn't change. And therefore there's an organisational and a structural issue there, as well as a simple pay terms and conditions issue, which successive governments have failed to address.
Thank you. Now, you told us about interacting through social media you told us about that, and also the COVID-19 with the affiliated unions, but you also mentioned that non-unionised workers were able to contact you through social media. To what extent were you able to advise or assist them in their particular circumstances through social media?
As far as we could, whilst being honest with you, protecting the organisation. So there were certain responsibilities that are implicit in the giving of advice. You can't just run around giving advice, and registered trade unions have, you know, clear processes and clear, frankly, insurances and others, because obviously one can become liable, legally liable, if one gives advice which turns out to be wrong or detrimental. So the first thing I would say was with some care, but there was an undoubted desire, which wasn't just being met by saying the Scottish Government has issued a new piece of guidance, or a particular sector has issued a new bit of guidance, click onto the Scottish Government or UK Government websites and find out what it says, because frankly these things are hard to interpret. So what we tried to do was to give clear interpretation of what we believed, taking reasonable advice, a particular piece of guidance would mean for workers. We published that interpretation on our website, and we also, from time to time, on issues like furlough, we would elicit bite-sized, kind of like 4-tweet pieces of advice, which also included links to wider reference, so that people could find some way of wading through the gulf between what they were experiencing in the workplace and what they were being referred to on government websites, where there was an awful lot of space for people to navigate between that. So we tried as best we could with limited resources to provide that service. We also managed to link up quite effectively with MSPs, who are obviously getting lots of concerns, people contacting them. And our record shows that the members of the Scottish Parliament and some other councillors found our advice and our short media, social media tweet-based bite-sized advice quite useful, because many of them were referring to it in their own social media and their advice to constituents.
In your statement, you also mentioned you were able to compare and contrast the experiences of non-unionised individuals with those who were unionised. What was the benefit of being able to do that, and how did the two compare?
I mean, the benefit would be that, you know, notwithstanding the myriad of issues in recognised union workplaces that you will have heard about and continue to hear about, you know, it is a fact, or we would certainly state it as a fact, that trade unionised workplaces are generally better protected, better paid, have better health and safety, etc. So we were able, I guess, to look at practice where trade unions weren't present, compare that to where they were, particularly in sectors which are what we would describe as part unionised, and the social care sector would be one of those, but we were able to compare, for instance, unionised retail with non-unionised retail. And whilst I wouldn't call that a quantitative piece of work, it was very valuable qualitatively, and partly because it backed up what our union reps were saying in many cases, so that they couldn't be accused of being alarmist or exaggerating the situation, but partly because it meant that we were able to advise government on actions it might take, not just based upon the fact of how that might play out where union reps were present.
Were there any key issues that stood out as being very different between the two types of worker?
We certainly, again, it's difficult to be quantitative on this, but qualitatively, I've already referred to the fact that we were hearing that non-unionised workplaces were, in some cases, just completely ignoring government advice. This would relate to the failure to close. Far more failures to follow normal health and safety protocols. You know, in the best circumstance, you will have an active health and safety officer in a unionised workplace is working with an appointed health and safety employer representative. We were hearing quite horrific stories with respect to, in all sectors, with respect to the breakdown or the complete absence, really, of health and safety procedures. Some of that would have predated the pandemic. Some of it would have just been inadequate responses to the pandemic. But yes, there's a very clear difference between having a unionised workplace who understands the protocols and what to do, and it can at least have disagreements based upon a framework, and people who have no framework at all. It's it's an employer responsibility under the 1974 Health and Safety Act to ensure that workers are consulted on health and safety issues, and unfortunately, generally speaking, that's a rather large failure amongst Scottish employers, but in the pandemic that became even more concerning.
And in terms of, because you speak about differences between NHS and social care staff in your statement, in terms of workplace support, morale and finances, did you see a big difference between NHS staff and social care staff?
Yeah, I mean, the first thing I'd say is whilst we did have significant contact from those working in social care settings where a union wasn't present, we had relatively few from the NHS. Obviously, the NHS is a larger workforce, but by proportion, those in social care were significantly more likely to contact us. And that fairly clearly for me is about organisational structure. The NHS, whilst no one's going to say that it's perfect, has an understandable organisational structure and chain of command, and also because pre-existing partnership working relationships, trade union employer directors on NHS boards. I think, and I can't find another reason for thinking why this would be the case, I think that workers in the NHS were much more aware and able to avail themselves either directly with the employer or through their union for support than was available in the social care sector.
You go on to talk about transport issues, transport to and from work for those in health and social care, and say that you raised these issues with the Scottish Government. What were your concerns and what did you hope the Scottish Government would do about those issues?
Yeah. So transport to work and the impact of transport on workplace health and safety is a slightly difficult issue. Health and safety, essentially, normally, with the exception of particularly some home working arrangements, stops at the door of the workplace. So we're involved in various campaigns, for instance, with hospitality workers to say that employers should take cognizance of how their workers get home late. But it's a contested area. Transport to work doesn't sit within the normal understood health and safety landscape or the 1974 Act. As I say, we don't think that's right, but it's the existing situation. However, as soon as we got into the COVID situation, I don't know if I give this example or not in my statement, I can't remember, a workplace might be a public sector workplace, a key sector workplace, particularly a big one, where workers are required to go to work, might be availing themselves in large numbers of public transport. Now, who else is on that public transport, how that public transport's being provided is going to have a direct impact on potentially workplace transference, because, you know, did you get it when you were sitting next to your colleague at work on the way to work, or did you get it while you were in the having lunch with your colleague at work? So we felt that, and we did ask the Scottish Government when we were talking about their transport regulations, we did raise not just the fact that we wanted to protect normal travellers, clearly obviously protect the transport workers themselves, but we wanted them to have some cognizance of particular bottlenecks. So, you know, near where I live, you can tell when the call centre staff are all clocking in for work because the train and the bus is totally full. Now, you can't just open a call centre and not think about the fact that the train that gets people there is going to be incredibly full. So that was our attempt, I guess, to ask the Scottish Government to take the greatest possible cognizance of that particular infection and transference risk.
Now, I want to ask you briefly about long COVID. We heard from the Secretary-General about that, but I want to ask you specifically about the response of the government to that. Now, of course, you raised the issue with them. Can you tell us about the initial response and how that evolved over time? Did it get better?
I think I would hesitate to be able to put a date on, of a time scale on when we first raised it and when we think effective action was taken, but I would say it was reasonably swift. It was included obviously in our Fair Work COVID statement, which from memory was written in April, so we're not talking about too long a period of time. And the principle of, in a sense, no detriment, the principle that if people were self-isolating or otherwise required not to attend work through COVID, should, in all public sector organisations and all organisations receiving public funding, should be protected, was inserted very quickly. That was obviously then distributed to public sector employers. I wouldn't say that it was perfect, but I certainly think it was a really important tool for our reps in order to negotiate protection for workers who were being forced to isolate. It had to do other things with that, which the General Secretary has referred to in terms of financial support, but I genuinely felt that was a success for us in terms of the recognition and, generally speaking, in terms of application. Towards the end, I would estimate of 2022, we began to hear noises that local authority and other employers were less than happy with the provisions within the Fair Work statement, and were clearly wishing to move to a situation where long COVID would be treated as any other illness rather than occupational illness or of a disability. And we tried very hard with government at that point to resist the alteration of the statement to take those protections away, and we were ultimately unsuccessful. So that would count as one of the significant disappointments, I think, in terms of the way that the government responded to our entreaties.
And do you think that was due to the requirement to balance business and the economy with?
I think, and we would generally be critical of sickness and absent management policies and the way they've developed over the period. There's been a move towards limited and quantified absence in terms of general illness, which we don't think is particularly good for workers, the service, or the economy. I think if someone's sick, they're sick, and they shouldn't be penalised for that. Sorry, I've actually lost the drift of the first part of your question there, sorry.
So I asked whether it had things had improved and whether you thought that, or not improved, and whether you thought it was down to business.
So in this case, if we term business as the delivery of public services, then clearly, and this is a consequence, frankly, of austerity and pressure on budgets. We've seen harder and harder absence management policies being introduced, and HR managers who do not want to have people off a significant period of time when they're unwell, and would either rather manage them out of the workplace or see them have financial detriment. So being frank with you, there was pressure coming on government from public sector HR not to implement this because they felt it would be difficult for their staff management policies. We would take the opposite view and say, don't come to work if you're going to make other people sick or yourself sicker.
Thank you. Could you tell us a bit more about the role that the STUC played in interpreting guidance for workers and assisting workplace health and safety officials?
Yes, so obviously workplace health and safety officials' initial and first go-to place is their own union who operate networks, Branch Democracy and the rest of it. But there's also, for want of a better term, there's a lot of expertise across health and safety officers and people. There's thousands who do a very good job. There's maybe hundreds for whom it is a bit of a passion. They've become experts very often in their own time, and they're not paid directly to do these roles. So we moved to create what we described as a health and safety community, so that essentially a community of health and safety officers across a whole range of industries and a whole group of unions could talk together. And that really is down to the talking. Very often that's about application. So you've got, and this is I guess what you mean by interpretation, you've got what's written down, and then you've got how that actually plays out in the workplace when you're having negotiations with management or conversations with workers. And inevitably there's going to be grey areas, inevitably there's going to be misunderstandings and the need for interpretation. So we saw our job, advised by this kind of expert group, for want of a better term, to look into what some of those were, and therefore to have, if you like, parallel guidance, whether it was in health and safety or other issues such as furlough. We could say, okay, this is what it says, but this is what it probably means, and this is what you might want to do in this circumstance to deal with this problem. So in a sense, it was problem solving between what was written down on the page and how people with expertise were looking to apply that on the ground.
10 minutes, Ms. Barami.
Thank you, my lord. Did you notice differences between the different types of workplace in terms of willingness to adapt to the guidance and take your views on board?
Undoubtedly. I mean, I should maybe have said this before, but we had a range of employers that contacted us, and the very fact that they were contacting us was a pretty good start. So there were undoubtedly employers who were in the vanguard of doing exactly the right thing. That included some small businesses. We were contacted by, I wouldn't particularly say employers in the social care sector. I think they had other places to go. But there was enormous differences in terms of application, in terms of communication, in terms of willingness to engage with workers and unions. And we could tell that by the people who actually wanted to know what we said rather than wanting to ignore us.
Now, you speak about people in social care going into work when they suspected they had COVID. Why was that? And did you see the same in the NHS?
We, as the STUC, and I obviously hope that the inquiry can rely also on the evidence of the unions who directly represent the workers. In the STUC's experience and the information that we got, either from our affiliates or directly from workers, there was a particular issue in social care. And I think that was large. Some of it may have been down to the undoubted dedication of health and social care workers, in this case probably misplaced. But largely speaking, it was economic. People simply could not afford not to go into their work. And we heard that frequently. You know, it was sometimes really, really quite distressing to have to tell people that our absolute advice was that they shouldn't go into work when we knew that was causing them, you know, enormous concerns in terms of their income. But the economic issue and the pay issue was absolutely enormous in terms of how people were relating to us, their decisions to go into work.
And you mentioned that you mentioned the social care support fund that had been introduced, and the fact that employers had to apply for funds themselves. Did the introduction of that fund alleviate the problem in the social care sector?
Partially. I haven't got statistics on this, but our sense would be undoubtedly partially. I think if it had been applied more directly, with less red tape, I think if it had been clearer which workers qualified and which didn't, and if a very much stronger line had been taken with employers who didn't apply at all, then it would have been better. But you know, as a concept and in terms of impact, it was definitely a very positive thing and something that we worked very hard to achieve. But as with everything, you've got the idea and then you've got the implementation, and there definitely could have been better systems of implementation, and probably wider awareness raising amongst the social care staff, remembering that a large proportion of them weren't unionised of what they could expect.
And you mentioned self-employed health and social care workers. Were they able to access that fund, or was the impact just ongoing on them?
No, I mean, our understanding is that they weren't. So you had to be a direct employee. There were also, and again, I couldn't attest or remember exactly what the ultimate impact of that was, but there was also a great deal of confusion about part-time workers and how the fund would be applied to part-time workers too. So there were definitely some bumps in the road.
Moving on briefly to the lessons you believe should be learned. You state that it's important for joint boards who govern health and social care and the NHS to have local plans as well as national plans. What issues did you see arise where this wasn't the case?
It's very different to operate either a health board or a joint board in the Highlands than it would be in Glasgow. But also the restrictions were different in different areas at different times. So you couldn't have a single response, given that obviously all key workers were expected to work with the environment, the geographical environment in terms of other people travelling, the time it took, car sharing, availability of public transport. There's a whole range of issues that came up in one area that wouldn't necessarily be coming up in another area, if for no other reason than just because of sheer geography and where the infrastructure was and who they had to reach. The extent of home visits in social care in one area would be different, and certainly the travel time. So what I was trying to get across there is that if we're talking about pandemic planning in the future, you have to have NHS-wide, social care-wide planning, and obviously that's why we think much more integration and public ownership of social care is absolutely vital. But that doesn't that doesn't preclude the need for people also to have local plans which have to be sensitive in the future to particular geographical, demographical and other considerations.
And finally, you state that there was great confusion during the pandemic between the role of health and safety executive and the role of local authority health and safety regimes. It was complicated further when the HSC were taking top-level UK-wide and then Scotland-wide positions. The actual inspections regimes are different from that. Our position is that the HSC should have devolved function just pertaining to Scotland. There should be very clear mechanisms for the Scottish Government to take a view across the local authority and inspection regimes about whose responsibility is what and make sure it is very clear to everyone. What issues arose in relation to the HSC, and how would such a devolved function address those issues in your view?
Well, the health and safety enforcement regime will by its nature always be somewhat complicated. So some of this is reflected in England as well. But even within health and social care, you have a different primary enforcement authority depending on whether it's in the local authority or in the private sector. So local authorities inspect private care homes, the HSE inspects local authority care homes. So already there's a difficulty there. But when you add in the fact that and I should say you can reference lots and lots of protocols between the HSC, the care inspectorate, the HSC and local authority enforcement officers. There's loads of protocols just to deal with the very busy landscape that already exists. But when in the case of the pandemic, when the Scottish Government is also saying an incredible number of things which are effectively about some form of health and safety regulation, that's one too many person in the conversation. And from our point of view, that ended up both with communication difficulties for the HSC. When were they talking about Scotland? When weren't they? How proactive could they, or were they, in our view, not very much in terms of promoting what the Scottish Government was saying rather than what they were saying UK-wide. I mean, this isn't the only reason we think that the Health and Safety Executive should be devolved, but it's a very good example of really where there seems no sensible reason, in our view, given the size of Scotland, why the HSC wouldn't be devolved. It would still continue, we think, to work with local authority advisors who also obviously have to adhere to the Health and Safety Act 1974. But it would certainly, I think, have delivered a far more direct, understandable, clean and clear way to advise both employers and workers on the best steps to take and to ensure that the Scottish Government's advice as it affected workplaces was in the primary position.
Thank you very much. Is there anything that we haven't covered this morning that you would like to address at this point?
I think I've covered everything that I wanted to address. I mean, I would just underline that the state of the sector before we started, which is it's not just the care sector, cuts across the public sector and so-called efficiency savings, and I'm not against real efficiency savings. They have the effect of cutting things right back to the minimal bone. So how much can I just sort of squeeze out if I reduce 2 staff here or do this or the rest of it? That's not a good thing anyway. But in terms of readiness for a major upset like the pandemic, it just leaves things in such a difficult situation. And people talk an awful lot about cutting away the fat and the slack from public services in order to save money. This is what happens when you do that. You're not ready for crises, and it could be a much lesser crisis than the one that we had, and I would still be saying the same thing. So my message would be that we need to stop using trite terminology for making the public sector more sleek and efficient. Of course, what that normally means is you don't have the capacity to deal with unforeseen situations, and we saw much of the result of that following the pandemic.
Great, thank you very much.
Thank you.
Yes, thank you, Mr. Cairney. 12:05 for the next session. Good afternoon, Mr. Caskey.
Good afternoon, my lord.
When you're ready, Mr. Caskey.
Thank you, my lord. Would you tell the inquiry your full name, please?
John Cairney.
And I understand that you've provided a witness statement to the inquiry for its assistance.
Yes.
For our records, the witness statement is reference SCI WT 0449 501, and the beginning of the statement is on the screen. Before you signed the statement, had you read over it?
I had, yes.
And is the content true?
Yes.
And do you wish to adopt that as part of your evidence to the inquiry today?
Yes, there's only one small change, and it's just the fact that HMP Kilmarnock is now in the public service, so that's now 14 establishments rather than the 13 I've referenced in the document.
At paragraph 1, you provide details of your personal background. I understand that you've been a prison officer for a while.
Yes, since the 7th of January 2002.
You also hold an elected position.
Yes, I'm elected to the Scottish National Committee Chair for the Prison Officers Association in Scotland.
And the Prison Officers Association is effectively the Prison Officers Trade Union, is that correct?
It is, yes. We're the only recognised trade union in the Scottish Prison Service for uniformed officers.
Right. And did you hold that post throughout the period of COVID lockdowns and so on?
I didn't know. I was just on the Scottish National Committee for the beginning, and I got elected as we probably came out of lockdown too.
But you have knowledge of what the situation was during lockdown?
Yes, I was the Scottish National Committee lead through COVID as it began.
Okay. I'd like to ask you some questions about the scale of the organisation that you are in. How many members do you have?
We have about 3,500 approximately in Scotland. We're part of the wider Prison Officers Association, which is approximately 35,000, but in Scotland about 3,500.
And of the prison officers that there are in Scotland, what percentage approximately are members of the Prison Officers Association?
Calculations are about anywhere between 85 and 90%.
And as I understand it, you have members who do not work in prisons but work in another particular institution. Can you tell us what that is?
Yeah, we have membership in the State Hospital, Carstairs.
But your witness statement doesn't go into that today, and therefore I'm not going to discuss that with you beyond what we've just said. Okay. At paragraph 7 in the witness statement, you say that the role of a Scottish prison officer is unique, and then you explain why. Can you just tell us in your own words why you view it in that way?
Well, we're working with people who, quite frankly, don't want to be there. You know, that they're there for crimes that they've committed. Some of them are quite violent individuals. They've got loads of social matters, you know, ongoing, you know, quite difficult challenges that we have with them, you know. So we're working with people who are quite challenging, is probably the best and safest way to put it.
At paragraph 8 in the witness statement, you say that during this challenging time, our members still had to deal with the usual daily pressures, and then you provide examples of that. Yeah. Can you just say a bit more about the situation prior to lockdown, just the general situation of prison officers?
Yeah, prior to lockdown, you know, when it was free movement, you know, we were dealing with a lot of, you know, assaults, prisoner on prisoner, prisoner on staff. You know, we have quite a high rate of self-harm amongst prisoners that, you know, impact on staff's daily jobs. You know, we've got prison regimes we have to supervise, you know, and to make sure that prisoners get their entitlements, you know, and they're supported, you know, throughout their sentence. So it's along those lines.
So you provide at paragraph A a general introduction, and then at paragraph 9 you outline, you go into this in more detail later, but you outline the difficulties that COVID brought for you as an organisation or as a membership organisation. Can you tell me about that?
Well, as we know, COVID, you know, when it rolled out, affected people with bad health, you know, worse than it would, you know, people with good health. And a lot of our membership suffered from bad health and underlying.
You're talking about your membership and not just people in your care. So
I focus on the membership here.
You can do either.
Yeah. Well, for our membership, the challenges we had was that society was telling us to stay away from people. It was telling us to keep a gap, you know, to keep a distance, 2 metres. That's what we were told. But the reality in the job we were doing was we were very much in close proximity with prisoners, you know, that we were actually having to work closer with them than we were being told in society. So it was quite a challenge at the very beginning.
And were there particular features of those in your care that made the situation difficult for them or more dangerous for them? Do they have a high rate of underlying health problems? Prisoners.
Yeah, for prisoners, yes, yeah, absolutely. There was a high percentage with underlying health problems.
And you say in your statement, many prisoners are, at paragraph 9, many prisoners are susceptible to contracting disease due to their immune systems being weakened by certain lifestyle choices, drug use, and general bad health. Yeah. So your position is that prisoners face particular difficulties in addition to your membership?
Absolutely, yes.
Okay. We heard evidence on the 19th of March this year from a Mr. Purdy, and Mr. Purdy is a senior official in SPS.
Yes.
He described that at the time that COVID appeared, a hub was set up communicating between important organisations and people dealing with the situation in prisons. Were you part of that?
I was, yes.
And what was your role?
I was representing Prison Officers Association at that committee, or in that hub group.
Right. And Mr. Purdy went out of his way to say that at that time in particular, there was a strong ethos of collaboration between his organisation, SPS, as employer, and the trade unions. Is that something that you want to comment on?
In the Scottish Prison Service, we are in what's known as a partnership agreement between trade unions and the SPS management, and that was a great example of how partnership working should work. You know, did we agree on everything? No, but we worked our way through it because we had to work our way through that group.
Did you feel that at that group in particular, your concerns and your input was being listened to?
Absolutely, yes.
And acted upon?
Yes.
Not always, but some of the time.
No. We're always going to have, you know, different opinions on certain things, but in a whole, it was done properly.
At paragraph 12, you talk about local coronavirus response groups. Can you tell us a bit about those? Although we heard from Mr. Purdy about those, but if you could tell us.
Yeah, what that set up was that what the national coronavirus group had set down as the thing to do. They then went to the local groups in order for the local groups to, you know, individualise it to their establishment, because each establishment works differently. It's different setups. So we gave a national steer and it was then worked out locally how they were actually going to bring it in.
And was that done by individual governors within institutions, or was there the equivalent of the hub, the trade union management collaboration group? Did that happen in each prison?
Yes, yeah, it was made up from local management teams, you know, and I assume I'm not privy to the makeup of each group, but I'm pretty certain it would have involved NHS partners, social work partners, chaplaincy, and so on, you know. But yeah, certainly our membership were represented by the full-time officials from each establishment.
And at paragraph 13, you also say something about the prisoners, those in your care, and the extent to which they cooperated. Do you want to say something about that?
Yeah, I just think it's important that it does get mentioned that, you know, as my statement earlier on where I was saying that a lot of the people we're dealing with don't want to be there, you know, and quite challenging individuals, but they complied fully, and I think it's testament to probably seeing it live and playing out live on, the national news outlets, hearing it from their families, etc. You know, they were very compliant, you know, going in.
Okay. Now, the next section in your witness statement is PPE, but I want to jump forward to something else in your witness statement, and then I'll come back to PPE. Can I take you forward to paragraphs 39 and 40 in the witness statement? And if we just wait, that will appear in a second. And you have a heading there, death of a fellow prison officer. Now, it's important that I say to you at this stage, we don't want that individual identified.
Yeah.
But can you tell us about that?
Yeah, it was, as you can see from the statement, I've put it was in Pullman, and young offenders institution in Pullman, and it was near the beginning, and it had quite a profound, impact on our membership, because the fellow was a popular individual. It actually affected the prisoners as well, or the young offenders and prisoners, as well, because they knew him and he was quite popular. I think it became real because it actually happened to someone that people knew,
and was he quite widely known within the whole of the prison community?
Yes. Also, with his unfortunate and sad death, we also had another two, another establishment who had died through the COVID as well, which had an impact on their community within them.
Were they prison officers or were they prisoners?
No, they were staff. They were
staff.
They were prison staff.
And tell me about the effect of those three deaths on the prison officer community at the outset of the pandemic.
It was very difficult. It was hard. It was hard to take, and it was hard to, think of the impact of it, because they were colleagues, and it's like the death of any colleague. It does affect us, and when it's attached to the COVID outbreak, as I say, it became kind of real that this isn't going to escape, anybody, so kind of buckle down and listen to the guidance and work through the guidance, because it affected the communities within prisons, but it affected the wider prison service as well.
The impression that I get from your evidence is that it really sobered people up, if I can put it that way.
Yeah, absolutely.
And people were then taking it even more seriously.
Yeah, as I say, it became real because it happened effectively, if you want to call it, on your doorstep. But it happened, and it happened, so. And when you know these people, and people are affected by these people, it just refocuses your mind of, no, this is real. This is a real thing that's happening. So, we have to follow all the guidance that we possibly can.
We heard evidence from Mr. Purdy that he was given information from a projection that perhaps as many as 600 prisoners might die. Was that information shared with you?
Yes, it was probably one of the very first NCRG, National Coronavirus recovery response group, NCRG, it's probably one of those first ones that's when these kind of predictions were coming out, and yeah, it's not a number that I probably would have even contemplated, you know, we could have hit, but yeah.
Mr. Purdy described it in his evidence to the inquiry, the figure as overwhelming. Was that a view that you shared?
It was a high number, you know. It was a gobsmack number, you know, that's what the prediction was, you know. And yeah, of course it takes you back because it's human life. Doesn't matter, you know. I know it was thing towards prisoners, and you know, I'm obviously here for the prison officers, but yeah, absolutely, and that would then have fed back down to our membership as well, who themselves would have been concerned with it, you know, because it's having one death is difficult to deal with. If you can multiply it by those numbers, you know, it would have been real difficult for our membership to have handled that, you know, kind of rate.
Okay, I'm now going back to where we were, which is paragraph 14. And you're talking there about PPE, and what you talk about there is that, reading that and the subsequent paragraph, that the availability of PPE changed over the course of the pandemic. Will you tell us about that, particularly to begin with, the initial stage? Yeah. What PPE was available to you?
The initial stage was, it was strange. I mean, because there was no clear guidance on it, and I've sat in the NCRG groups at the very beginning, where we were actually looking at 5 and 6 different face masks. You know, we didn't know what kind of ones we were getting. You know, in my statement, but I kind of took it out as I refined it. I called one of the masks a Bane-style mask from Batman, the fella that the mask in the front. And that was the kind of stuff that we were looking at. You know, is this what we were going to have to wear? Because we didn't know what we were having to wear. And the guidance we were getting at the beginning from Health Protect Scotland and NHS Inform, etc., was you won't need masks. So when you're holding these ones to being told that
you don't need them,
it was that impacted me as much as Mr. Purdy saying about the 600 deaths, because I'm going, how can you have that figure but not given that protection? It made no sense, you know. So it was difficult and it was challenging at the start.
And what type of masks did you ultimately, in general, end up wearing?
We ended up with type 3, is it IR type 3? It was kind of the surgical mask, you know, would be what we ended up with.
And how long did it take you to get those?
I don't know the exact time frame, so apologies for that, but it was way after we were walking about Tesco and Asda with them on. You know, it was way after that, because the guidance we were getting is if you can keep 2 metres apart, you don't have to wear them in your environment, which was something that get challenged right from the very beginning, not just from trade unions, from SPS management as well. In fairness, you know, it wasn't just us, it was the whole collective that was challenging that.
And at paragraph 15, you talk about particular functions of your job, which means that you need to come into close contact with others. Can you just explain that to us?
Well, as I started off with as well, we've got, you know, prisoners in the prison that, you know, they're there for varying reasons. Some people's anxieties are different, some people's anger's different. So there was times when our membership were having to go in and perform control and restraint to try and take prisoners back under, you know, some form of control and some kind of order. You know, so we're being told, stay away 2 metres, wear a mask, walk one way in a supermarket, to you don't need a mask and you're going to have to restrain a prisoner who, you know, is having discipline issues, shall we say, you know. And so it was so unreal what we were actually being asked to carry out.
And you spoke about guidance earlier. Certainly during the initial stages, was there specific guidance for what should happen in prisons?
No.
What guidance were you relying on? Was it guidance for another sector?
Going in, we were more aligned to the care sector. So we were, you know, be like care homes, you know, have that. But even then, care homes went beyond us, because their staff were then given masks earlier than, again, our members, and staff in a whole were given, you know. So although we were aligned to them, you know, we were then quickly overstepped by.
And when you were eventually given masks,
yeah.
Were you given training on how to use them?
Yes. The difference between a face covering and a face mask was an e-learning package. You had to do I can't remember how long it was. I want to say it was as quick as 3 minutes, but I might be wrong. And it's how to properly put it on, how to properly take it off, and how to, you know, manage it while it's on. You know, so that's what took us from a face covering to a face mask.
And you talk at paragraph 16 about some prisoners being supplied with masks.
Yeah.
I don't need to ask you which prisoners got them, but did they get the e-learning in terms of how to wear them?
No.
Okay. At 17, you're talking about social distancing, and you say there was a particular problem with older type prisons.
Yes.
Can you tell us about that? Although we heard from that from Mr. Purvey also.
If you think of the layup of a modern prison, I mean, the gallery's probably no wider than this table, and the guidance we're being given is 2 metre social distancing. You know, so it was actually impossible for our members to have that space, that safe space that government and professionals were telling us to have. Every minute of every shift, we were in that space, and you know, so there was a fundamental difference. That, and you take it into a more modern place, for instance, Low Moss, where the gallery's probably the length of the room. You know, so there was opportunity to have the social distancing, the 2 metres guidance within that area. So there was certainly an issue for the Victorian style prisons.
Now, we heard quite a lot of evidence, and I don't need you to repeat it, about bubbles within prisons, about prisoners being grouped together into bubbles. And, sorry, I've just... were prison officers also attached to particular bubbles?
I don't know. I can't recall if I'm honest. I would think by actually the way our attendance patterns work, then you would be, you know, because generally you work in the same place with the same prisoner group. So by default, you maybe have been, but I don't remember. I don't recall it actually being, you know, described as you work in this bubble.
At 17 and 18, you go back to what you were talking about a moment ago about the difficulties of social distancing in Victorian prisons. And you talk about some staff being frustrated as a result of that. Can you tell us about that?
Yeah, as I say, we're watching, you know, we're watching updates every night that's reinforcing us to do, you know, live our life in a certain way. You know, you have to stay this. There's no non-optional. You have to do that. You have to stay away. And then we were coming into our work, and it was just it didn't exist. You know, that protection didn't exist. And everything that we were told was they're trying to mirror the community and do stuff in the community. You know what it's saying there, and quite frankly, it wasn't happening. And you know, and again, that's the fault of design. It's not the fault of, for me, an individual. It's a fault of design. You know, that it wasn't allowed for, you know, our members that worked in these types of prisons.
You move on to talk about shielding, and you indicate that once shielding letters were issued to your members, then SPS would basically relieve them from duties temporarily. But you also say there was a 6-week window before that happened.
Yeah, there was a window. I think it's, again, probably as society was, it took a bit of time for, you know, NHS to actually get that completed, that piece of work completed. So our members were working in the area, you know, or being forced to go and report sick because they just didn't want to put themselves in that position of coming in, you know. So they either took the decision of going sick themselves or coming in and trying to find a non-prisoner facing role that would have maybe gave you a wee bit more or less exposure.
And how were SPS in terms of arranging those kind of roles before the shielding letters arrived?
If I'm being honest, that would have probably been dealt with more at a local level. I wouldn't have really had a sight of that, you know, at the national group. That's something I would expect our local branch committees to have done. So I don't have any kind of feedback as to was it successful or was it not.
Do you know if there was any positive action by SPS in terms of seeking to identify staff members who might require additional protection prior to the shielding letters?
If I'm being brutally honest, I think it was more reactive. You know, I think it was more a member of staff going to them, you know, to say, here's what I have or here's what it is. But as I say, we were quite chaotic at the beginning, you know, so I would imagine, you know, everything was done, you know, quite quickly, or, you know, the initial support and care that was needed to go in to the individual case.
And what about individuals who didn't have health problems but who had family members who would require a shield? How would that be dealt with?
Well, that was a bigger problem, you know, when the shielding letters, even when the shielding letters were done, because the SPS were of the mind that unless you have the shielding letter, then our expectation for you is to come to your work, you know, because the letter by default didn't extend to them. So that's probably where more trade union interaction was needed with the employer to try and actually explain to them that. An example being, we had someone's wife who was going through intrusive cancer treatment and had an opened wound, and had a shielding letter to say they can't go, but the expectation was that member of staff will work. And what we're trying to explain to the employer was it's impossible, it's unreasonable to ask that person to come to work because they're taking home or potentially taking home something that could directly impact their wife, you know, so that was quite a challenge.
And you spoke earlier about what might be regarded as generally poor health amongst the prisoner community.
Yeah.
Do you know anything about increased vulnerability to infection by COVID amongst the prisoner community? I mean, in the sense that if they're more likely to get COVID, then your member with the wife who requires to shield is more likely to be exposed to the virus. Can you say a bit about that? I
don't really have much to say on that because I don't really have the evidence that would support anything that I could probably add to it, so apologies for that.
Okay. The next thing that I want to ask you about is what you've headed, health and safety impacts, but in reality most of the statement relates to control and restraint training.
Yeah.
Tell us about that.
Well, what happens is we all get initial training for control and restraint, and then every year we have to do an annual refresher. So we, you know, to keep us ticking. So because of the restrictions that were in place, the decision was taken that the SPS will extend people's competency from a 1 year window to a 2 year window.
Right, now you said we get the refresher training,
Yep.
you know, to keep us ticking, is
Yep.
the phrase that you used. Were there other reasons, were there legal reasons for the frequency of the refresher training?
It's set up in the training parameters that every year you have to go through an annual refresher. So it's there in the SPS are audited against it. You know, it's part of their key performance indicators. So as that you will make sure that you have this percentage of staff trained in control and restraint every year.
And during COVID, that was extended rather than annually to become biannually.
Yes.
You also referred to the possibility of it becoming every 3 years.
Yeah.
What was the reaction to that?
That didn't land. It didn't land well with anyone, quite honestly. You know, because first of all, our membership, we identified or quite quickly seen that we need to keep the refresher going. We need to keep training people and keep refresher going. And the SPS were not willing to extend it to 3 years because they had a corporate risk, I believe, that they would have been concerned about as well.
And in terms of this annual refresher training, which became for a period biannual, has it now gone back to annual?
Yes. Yeah.
Is that seen as a tick box exercise, or is it actually something that the staff want to partake in, that they think it's important?
No, it's absolutely important. It's a massive part of our job, and it's a massive part of our role. So it's far from tick box. You know, it's something that our membership know they require to have, you know, in order to do their job properly, if and when, you know, it becomes volatile.
Tell me about, I'll come back to in lockdown, but coming out of lockdown,
Yes.
there obviously was a backlog of training needs for control and restraint. How was that dealt with?
What had happened was, because we went on to a COVID roster, a COVID attendance pattern, it means we had more staff. So as we were coming out and the shielding letters stopped, and so we actually had a bigger bank of staff. So rather than going back to the traditional attendance patterns straight away, they utilised that core of staff to actually get as many people back through the training that we could. And then once we had up to, I think it's 85%, I could be wrong, but it's about 85%, that's when we then went back to traditional attendance patterns. So we managed to catch the training in for our members in that period.
You spoke about the change in work pattern, and we heard evidence from Mr. Purdy that it became 8 in the morning till 6 at night, and you spoke about we've got more staff. Did you actually get more staff, or was it simply the change in working patterns meant that there was more staff available?
It was a change in working patterns.
Was there an increase in the number of staff during COVID?
No.
Was there a reduction in overall staffing levels?
Not more than pre or post COVID time.
You see at paragraph 30, there was a mixed response from your members about the change in working patterns. Yeah. Some people wanted to go back to the old patterns and some people wanted to stay. Can you tell me what the arguments on each side were?
Well, we have staff who like to finish on an early shift at an early shift time. You know, it's just the way it's always kind of been in the SPS. So a lot of staff are used to it. They've built their life on it. You know, they've got childcare arrangements around about it. You know, so they see that as their attendance pattern. You know, it's not too damning. You know, because if you go in at 6 o'clock in the morning, or 8 o'clock in the morning, whatever time, and you're working right through at the end of shift, you don't have a break, you don't have an out, you know. So if you've got a prisoner that's riling up at 8 in the morning, you've got them to 6 o'clock at night. Whereas if you're on an attendance pattern, you know that you're either coming back shift or you're finishing early shift, there's that natural, you know, break for you. Whereas if you're in it all day, you know, you're there. But the flip side of it is, by people working, some folk enjoyed it because by working a longer day, they worked less days. You know, our attendance patterns up until December coming is 37 hours a week. So that's the expectation, is 37 hours a week. So a lot of folk are saying if we can get that in quicker, I get more time in the house. But as I say, but a lot of folk, it doesn't suit them. They prefer the early shift, back shift attendance patterns.
I understand that in the prison officer community, overtime is referred to ex gratia payments. Yeah. What was the impact on overtime?
Effectively, it disappeared. You know, that there wasn't. I don't have the figures as to how much money the SPS says, but if I was to hazard a guess,
the SPS.
How much they would have saved by paying ex gratia. If I was to hazard a guess, I'd say it's, you know, multi-millions is what they would have saved. But so the reality of it is, we have got people who rely on doing ex gratia shifts for their own lifestyle. You know, so when that came to an end, there was folk losing out on, you know, quite a bit of money per month because it wasn't there.
Were management slow, in your view, in reverting to the traditional work pattern? Because obviously they were saving money.
I don't think they would have used the excuse of or the reason of saving money. I think it was more we had disagreements over it. Let's be frank, we had disagreements over it, but the SPS had said that they don't believe we were in a position to exit the attendance patterns any sooner, because they wanted to get the courtly role training back up and running. They wanted to make sure that there wasn't going to be a third or a fourth lockdown, you know, that they were trying to come out at before the committing. And we were quite honest with them that we wanted to come out a lot sooner. Our membership were telling us they wanted out a lot sooner, you know, so it was quite a challenge, you know, to actually get out of it. But I don't think there was ever a motive to keep us there, because the commitment was given at the start that this was only going to be a short-term change. Short-term ended up being about 2 years, but we all thought we were going to be in the house for 4 weeks.
You talk about the National COVID Recovery Group, and I've asked you a fair bit about that already. I just want to clarify the frequency with which that met at the beginning of the pandemic.
Every day.
You were part of that group.
Yeah.
Were all of the main senior managers in SPS overall also involved in that group?
The as senior as it got would have been Mr. Purdy, who chaired it, and he would then have went to the exec management group, being a chief executive, and that kind of strategic board level is where he would have taken the NCRG findings and recommendations up to that level. But as senior as it got was Mr. Purdy and his kind of equivalent colleagues, which is as senior as, you know, you're probably going to get the directors within the organisation.
Those were the people you were working with.
Yes.
Within that group. Okay.
Yes.
The next part of your witness statement relates to financial impacts.
Yes. And
we've already spoken about the impact on ex gratia payments, overtime payments. But you also say that there was a quite significant impact on your membership as a result of not car sharing.
Yeah.
Can you tell us about that?
Yeah. Again, our members had to follow the guidance that was out there, and the guidance that was there was you had to travel alone, you know, and so we generally have what we call carpools within, you know, our attendance patterns. So it's no uncommon to have 5 people sharing a car, and they all drive 1 day each, you know, and work it out, you know, take it down to even 4 or 3, you know, it cuts quite, you know, the distance that you're travelling yourself and the cost to yourself down quite dramatically. But when we then went into the guidance saying you can't be in a car with anybody else, it had a financial impact, you know, on quite a severe financial, because we had people, for instance, coming from Kilmarnock to Berlin to work. I mean, it's an 80-mile round trip, so doing that and paying for that every day yourself as opposed to in your carpool had a detrimental effect on our members.
And presumably management know about that because they had staff's address.
Yeah, and again, if I'm being fair to them, all they were doing is they were just passing on the guidance that was laid down, you know, via the NCR group by, as I say, Health Protection Scotland, NHS Inform Scottish Government. All we were doing was just following the guidance and guidelines that were set by them.
As a membership organisation, what can you tell us about the impact of long COVID on your members?
Again, because I'm in the national executive, it's not really something that I witness in a day-to-day. That would probably be more our local branch committees would be in a position to have better information. But I do know there is members suffering from long COVID. I do know of members that have had to leave the job under ill health capabilities because of long COVID. You know, so there is an impact that's been felt from our membership with regards to long COVID. I don't have any, you know, figures as to how many are suffering from it.
Towards the end of your witness statement, although some of them are quite lengthy, they are effectively bullet points of things that you identified as problems. I wonder if I could go through them just as bullet points and ask you to expand on each one. Okay. Firstly, childcare impacts, which people might be surprised to hear me saying, but can you explain childcare impacts?
Yeah, that kind of goes back to the attendance patterns, because it's not unknown to see prison officers handing kids over in car parks. I don't mean that lit. I mean, one comes off shift and goes away with a kid, and the other one comes on shift, you know, and that disappeared because they were all on a one.
Everybody was working the same shift.
You weren't allowed anyone in your house. You know, that was as simple as that. You could leave your house for an hour's exercise, so you couldn't rely on parents or, you know, siblings coming to help out for childcare. So that was real. You know, a lot of officers have got partners who were also classed as key workers who had to go and work, you know, in different sectors. So I had an absolute huge impact, the childcare, on our members for the period that you weren't allowed them to help out.
Okay. Impact on induction for new staff of COVID.
Yeah.
Tell me about the impact.
It was alien. You know, when you come into the organisation, you kind of do everything in teams. You do everything. No, I don't mean teams virtually. I mean, you know, as a collective in teams. You know, you do that. You work together. You know, you work in, you know, as a section within our college. To actually go there and be told to separate out, it was quite alien to them. It was quite difficult and quite challenging, you know, for folk to build up the relationship, the rapport, you know, with each other, because it didn't exist.
Now, we saw in Mr. Purdy's explanation about his work history that he spent quite a long time acting up into promoted posts, and I understand that's a common thing within the prison service. Is that correct?
It is common, but getting a lot better. They're filling a lot of roles now substantively, which is good.
And during COVID lockdowns, was there a problem with people being stuck acting up?
Not that it was highlighted to me. You know, it's never an issue that came to myself, you know, with it. But business kind of moved differently in those times. But so I don't really know the best way to answer it. But it was never a huge issue that came across my desk, certainly.
Was there a distinction, or is there a distinction to be drawn in terms of impacts, and I'm looking now at paragraph 48, between operational staff, such as your members, and others who work at prisons?
Yeah, this is arguably the single biggest legacy issue that we have from COVID in here, because our members can't work from home. It's impossible. You can't take 20 prisoners home with you. You know, you can't do it. But you know, our non-operational colleagues, you know, have got that opportunity to work from home. You know, and they actually do. They downscaled our headquarters, for instance, because there was no need, because everyone's now remote, with remote access and working, you know, from home. Whereas I say, 100% of the time our members are in establishments working, you know.
And has that created a degree of difference in within the organisation?
It's created a difference for us as a trade union in how we are looking to be identified by the employer, you know, because it's quite clear that the roles are different. Our pay scales are the same, but our roles are extremely different, you know, in what we do. And as a trade union, we are, you know, pushing for the employer to recognise that.
And during COVID, what was the impact on the association itself? How, for example, did the workload of elected officials alter during that period?
What had happened was our local officials were fine, because they were in and they were doing their job all locally. At a national level, as I say, I was sat on the coronavirus response group, but a lot of my colleagues on the Scottish National Committee started to go into back working in prisons to help out. But it actually had a detrimental effect on us as a trade union, because I'm coming out COVID meetings and I'm needing a table steer for where we're going to go and how we're going to, you know, position ourselves with a change. And when they were working in establishments trying to help out, it was kind of falling down. So we quite quickly had to say, no, we need you back out, because we need to run the executive, you know, and make decisions at that level to impact everyone, rather than one or two people going in to help out.
Now, a recurrent theme in the statement that you've provided, I'm not going to take you to a particular paragraph, but a recurrent theme is that prison officers are not recognised, or were not recognised, as key workers. Yep. Can you say something about that?
Yeah, that's the reality of what it is. You know, our membership on the classified as emergency workers, and it's quite shocking that that's the case, quite frankly, because of the nature of the job we do. You know, and as I say, people lost their lives, but low-level stuff for us was we're watching nurses and police officers and firefighters going into supermarkets early, and, you know, being able to jump queues. Our membership for me are that same mould. They're emergency workers. That's what we do. You know, we're frontline staff dealing, you know, with what we deal with. But that was never extended to us, and it was quite a bad taste again for our membership, because not only in this, but in pension fights and everything, there's just not that recognition of what we actually are.
What was the issue about pensions?
We're going through a campaign now to reduce our pension age back to 60. Our pension age is now 68, so they're expecting operational prison officers to work to 68, whereas the ring fence of police, fire brigade and army and all that left us out. So we are trying to right that wrong. That goes as far back as 2011.
Okay. Now, I haven't asked, because I don't need to ask, about the vaccination programme for prisoners.
Yeah.
What we were told, in essence, is that prisoners were dealt with in the same way that the general public were dealt with, so that those 80 plus were the first group assessed. We've also seen evidence that prison officers are in a high-risk environment. was there any concession in terms of prioritising vaccinations for prison officers who wanted it?
No, short answer, no. A bit of content to it is, as an NCRG, we did go and we did take it to, again, Health Protection Scotland, Scottish Government, NHS and Form, because we were of the opinion that we actually should be, I think, we were maybe 5 times more likely to contract COVID in the environment we worked in. Bearing in mind that's 5 times more likely to actually pass it on as well. So the decision to exclude us was one that it made no sense, but we had to go through the vaccine programme the same as everyone else did.
So you weren't given any prioritisation because of your increased risk?
No.
Can I ask you one more thing about guidance? You obviously saw lots of guidance, and you said to us that that was not specifically directed at people in prison. How did you feel about not being given specific guidance for the environment you were in?
Frankly, it was madness. I mean, how they could expect us to operate from guidance that wasn't specific to the environment that we worked was, it made no sense. And it was a massive source of frustration to us that, again, are we forgotten here? Do you know no prisons exist? Therefore, just let them deal with that guidance. Our members were, and all staff, were living this really concerning, really difficult and challenging, worrying time. And it's as though we were forgotten. Just give them that guidance and let them tie to that. It's impossible. You know, how we came through that and how the organisation came through that in a state that wasn't worse than what it was is absolute huge credit to everybody involved.
Paragraphs 54 and 55 of your witness statements, you describe your hopes for this inquiry. Could you read those paragraphs for us, please?
Genuine recognition that our members worked in a complex, challenging and dangerous environment, and we were truly on the front line at great personal risk, and that they were flexible, adaptable and entirely committed to getting everyone through the most difficult times in recent history, and genuine recognition for our members as emergency workers.
And those are your organisation's hopes for this inquiry?
Absolutely.
Thank you. Those are all the questions I have for you. Is there anything important that you think we haven't covered that you want to say?
No, everything's covered for me, thank you.
I'm very grateful.
Thank you very much.
Thank you, my lord.
Thanks, my lord.
2 o'clock.
2 o'clock.
Next session.